Hello everyone and welcome. In this lecture video we are going to cover the appendicular skeleton. The appendicular skeleton consists of 126 bones and it's consisting of the shoulder girdle, the arms, the pelvic girdle, and the legs. Each of these components are listed. The shoulder girdle is made up of two bones, namely the scapula and the clavicle. The scapula can be found on the posterior side of the thorax, and that's where the scapular region gets its name. The clavicle is more so often referred to as the collarbone. That's how you've probably colloquially heard it called before. But its scientific name is the clavicle. And just those two bones make up the shoulder girdle. Now, to the shoulder girdle, the arm will attach, and the arm begins proximally with the humerus. This is often referred to as the arm bone, and it goes from the shoulder all the way down to the elbow. Now, as we enter into the forearm, we'll find two bones, the radius and the ulna. In the anatomical position, the radius is more lateral, and the ulna is more medial. As we discuss the carpal region in the anatomical terminology presentation, the carpals are 8 bones that can be found in the wrists, and they will attach to metacarpals, which can be found making up the hand, and the phalanges, which are found in the fingers. Now, the next major component we have is the pelvic girdle, and the pelvic girdle is made up of 2 coxal bones, one on each side. But each coxal bone is made up of 3 other bones, namely the ilium, the ischium, and the pubis. And I'll show you some pictures of each of these 3 bones and where they can be found on the coxal bone in just a few slides. As for our remaining component, the leg contains just about as many bones as the arm is going to contain. The femur, which is going to stretch from the hip all the way down to the knee, is the longest and strongest bone in the body. And right on the knee, specifically in the patellar region, we will find the kneecap, which the scientific name is the patella. Now, below the patella and below the femur are 2 bones, the tibia and the fibula. The tibia is the more medial of the two, and the fibula can always be found more lateral. And instead of carpals, down here in the ankle, we will have tarsal bones. There are 7 tarsals. The metatarsals, which make up the main structure of the feet, and then the phalanges, which can be found in the toes. Now, the metacarpals and the phalanges on the hand and on the foot have a very similar naming system, so we'll really only need to learn that naming system once, and you'll be able to translate that for both of these. So let's start diving into the difference between the appendicular and the axial skeleton. So during the axial skeleton's presentation, we discussed the major components that were the skull, the vertebral column, and the thoracic cage. We now know that there are quite a few bones that make up the skull. We have a few different types of vertebrae, and we also have several different types of ribs as well. But we are more so focusing on the appendicular skeleton, which is shown here on the right. This includes the shoulder girdle, the arm, the pelvic girdle, these are the 2 coxal bones, and the leg. So we can see each of those components shown here in red. We will begin with the shoulder girdle. So the shoulder girdle consists of the scapula and the clavicle. You can see the scapula shown here, and the clavicle shown here. Now, the scapula is a flat bone that has quite a few landmarks found on it. And here, the clavicle is going to connect the scapula to the manubrium of the sternum. The scapula can be found posterior to our thoracic cage, and you can actually feel this bone on your back when you feel the shoulder blade. So let's start to break down the individual parts of the scapula. We're looking specifically at the posterior side of a right scapula. That's labeled down here. So this sits just behind the thoracic cage on the right side. The first of the structures that we see on the scapula that we want to note is the spine of the scapula. The scapular spine is what is also referred to as our shoulder blade. The spine of the scapula will separate 2 major fossa, namely the supraspinous fossa and the infraspinous fossa. Now, each of these terms are nicely named based on exactly what they look like. These are both fossa. It's a basin-like structure. So this fossa is superior to the spine of the scapula, hence why we name it the supraspinous fossa. This fossa is inferior to the spine, and that's why we call this the infraspinous fossa. When we start to learn the muscles and we get into the rotator cuff specifically, we will find that 2 of the rotator cuff muscles are known as the supraspinatus and the infraspinatus muscles, and each of those will sit in their respective fossa. Now when we rotate the scapula 180 degrees, we're now looking at the anterior side. We're still looking at a right scapula, but we want to understand that this front side is much smoother. We don't see the spine of the scapula over here. So that is one way that you can identify the sides of the scapula. Based on the presence of the spine of the scapula, that will tell you that you're looking at the back. Now on this scapula, on the front side specifically, we also have another fossa. This is going to be the biggest fossa on the bone. This is our subscapular fossa. And sticking with the same convention as we did with the infraspinous fossa and the supraspinous fossa, the subscapularis muscle will sit inside of the subscapular fossa. So these three fossa make up the majority of the surface area of the bone. But you can see that on the superior portion of this bone, there's quite a few other structures. One of those that can be seen from the anterior side is the suprascapular notch. Now don't overthink this. The suprascapular notch is the notch that is superior to the scapula, or it's on the superior part of the scapula. Now, as we rotate the scapula to its lateral side, we can start to see some other structures coming out. However, what we can also see is that right here, this is the supraspinous fossa. We have our infraspinous fossa here, and the subscapular fossa that can be found here. This little drawing down here is a nice way to remember where each of these fossa can be found on the scapula. Now, specifically, there are three other structures on the scapula that we need to keep in mind. And we'll start with the glenoid cavity. The glenoid cavity, sometimes also referred to as the glenoid fossa, is the place where the humerus bone will come to articulate with the scapula. Again, the humerus bone is the arm bone that stretches from the shoulder down to the elbow. So that particular bone is going to come in and sit nicely right here in the glenoid cavity. Now, on top of the glenoid cavity, we will have this very large bone projection known as the acromion process. The acromion process is what gives the acromial region its name. The acromial region was found on the superior aspect of the shoulder. And in fact, you can actually feel the acromion process on the top of your shoulder as well. Now we'll also have the coracoid process, which projects a little bit more anteriorly. This process is specifically serving as an attachment point for certain muscles that can be found on the arm. Now the other bone that's found making up the shoulder girdle is referred to as the clavicle. Now you may have heard this referred to as the collarbones before, which is an appropriate name. However, in this class we will use the term clavicle. The clavicle is a roughly S-shaped bone with two ends, and one end is going to articulate with the acromion process, and the other end is going to articulate with the sternum, specifically the manubrium of the sternum. So this end that's a little bit more rounded is referred to as the acromial end of the clavicle, and this end that's a little bit more pointed is the sternal end. Now on the underside of the clavicle, we have one projection over here known as the conoid tubercle, and that will be the one major structure that you need to be aware of for the clavicle. So that pretty much sums up the shoulder girdle. We have our clavicle here. This is our sternal end and our acromial end. We have the acromion process that can be found here, our coracoid process that can be found here, and we're looking at the anterior side, so that tells us we see the subscapular fossa. Also, another reason that we know we're seeing the subscapular fossa is that there's no spine of the scapula, because the spine of the scapula can be found on the posterior aspect. Now we'll also find the glenoid cavity here, which is where the humerus is going to articulate with. And this is the bone that we're going to go into next. So the humerus stretches from the shoulder down to the elbow. The humerus has quite a few bone markings that can be found on it, and one of the things that you're going to have to start making sure that you can do when it comes to the exams is determining which side of the body these bones belong to. So we are specifically looking at a right humerus. This is the posterior side, and this is the anterior side. Both of these depict a right humerus, and we're showing you both sides. So the first thing that I want to tell you about the humerus is that since this is the posterior side, we want to look at where the head of the humerus is pointing towards. This head of the humerus must articulate with the glenoid fossa. So if you can determine which side is posterior, you can then use the head of the humerus to determine which way that head is going to articulate with the scapula, and that will give you an indication of which side of the body that bone belongs to. Now, as we look at the distal end of the humerus, we'll find that this being the anterior side, and this being the way that the head is pointing, this is going to be the lateral side, and this is going to be the medial side. Now remember, we have a projection for muscle and ligament attachment referred to as an epicondyle, and the humerus will contain both a lateral epicondyle and a medial epicondyle. Epicondyles are raised areas above condyles, so you can see that each of these places on either side, the lateral and the medial epicondyle, will serve as an attachment point for certain muscle tendons. As I have already explained, the head of the humerus can be found up here, and there's a very, very important landmark on the back side of the humerus that you're going to use to determine whether you're looking at the front or the back of the humerus, and that is referred to as the olecranon fossa. The olecranon fossa is a large indentation on the distal end of the posterior side of the humerus. This space allows for what's known as the olecranon process to come sit within it. The olecranon process is found on the bone known as the ulna, and that will help for the movement of our forearms towards our sides, and that will allow for us to continually contract and relax our forearms. I will point this landmark out a few more times throughout this presentation. Now, midway through the diaphysis of the humerus, we have a projection known as the deltoid tuberosity. Now, we haven't quite gotten to the muscles yet, but we will find that the muscle that sits right on top of the shoulder is called the deltoid. And in fact, that muscle will insert right here on the humerus, hence where we get the name, the deltoid tuberosity. Now, if we can divert our attention back to the distal end of the humerus, you'll see that there are several different condyles that can be found on the humerus, and another fossa that can be found on the front side. This fossa on the front side is referred to as the coronoid fossa, and this fossa will allow for the coronoid process to come in and sit when the arms are contracting and relaxing. As for the condyles that can be found on the distal end, we have the trochlea, which can be found here. This here is the trochlea, and we can find the capitulum, which is more rounded in its shape, and it can be found closer to the lateral epicondyle. From the posterior view, you can also see the trochlea back here. The trochlea forms this little groove, where a specific structure on the ulna, known as the trochlear notch, will nicely hug around the trochlea and allow for that contraction and relaxation of the forearms. The capitulum will serve as an articulation point for the bone in the forearm known as the radius. This picture will nicely show you where the dividing line is between the trochlea and the capitulum. So you can see the capitulum here. This is more of a lateral structure, and the trochlea here is sitting more medial on this bone, and it allows for the trochlear notch to come in and sit. Now, I know we haven't gotten to the trochlear notch and a lot of the structures on the ulna, but once we get to the ulna, you'll see how all of the bone projections on the ulna will sit nicely within the fossa and in the grooves of the humerus. Here's our medial epicondyle, and here's our lateral epicondyle. In fact, the medial epicondyle can be distinguished because it tends to be more pronounced than the lateral epicondyle. And since we can see the capitulum and we can see the coronoid fossa, that tells us that we're looking at the anterior side of the humerus. We will also have another tiny fossa known as the radial fossa, and that is where the radius will sit when our arm is fully flexed. Now, once again, on this slide, we can see the olecranon fossa. Comparing the olecranon fossa to the coronoid fossa, the olecranon fossa is much larger, and that is in fact because the olecranon process on the ulna is going to be much bigger, so it needs a greater space that it can sit within. Here at the proximal end of the humerus, we'll find what's known as the greater tubercle and the lesser tubercle. The greater tubercle is more lateral in its size, and as its name would suggest, it is much bigger than the lesser tubercle. The greater tubercle is large enough that it can be seen from both the anterior and the posterior view. And the lesser tubercle is found medially on the anterior side of this bone. The presence of the lesser tubercle on the picture will also help you to distinguish whether or not we're looking at a right or a left humerus. I have added this picture into the slides to demonstrate for you what a left humerus will look like. Up until this point, we've really only seen a right humerus, so I wanted you to have something to compare that to. You'll see that all of the structures are exactly the same, however, they are just slightly reversed. The right humerus had its olecranon process on the posterior side, but its head pointed the other direction. So here, showing us that this is the posterior side because we can see the olecranon fossa, that's going to indicate that the head of the humerus is pointing towards the glenoid fossa, which indicates that this here is a left humerus. Now the next two bones that can be found in the arm are referred to as the ulna and the radius. The ulna in the anatomical position is found more medially, and the radius is found more laterally. So one way I like to refer to each of these bones is that in the anatomical position, the radius is on the thumb side and the ulna is on the pinky side. Both the radius and the ulna are going to have a little projection at their distal ends known as the styloid processes. This one is referred to as the styloid process of the ulna, and this one is referred to as the styloid process of the radius. I guess those names aren't particularly creative. However, they are very helpful to tell you where these processes can be found. Now, I wanted to just make sure that you are aware that this is not the first time that we've seen a styloid process. In fact, we also saw a styloid process when we were covering the axial skeleton up in the skull. The styloid process was found just in front of the mastoid process on the skull. So just make sure that the one up in the axial skeleton is solely referred to as the styloid process, and these two are referred to as the styloid processes of the ulna and the styloid process of the radius. Now, if we focus in on the proximal end of these bones, we will see that there are several structures that will hopefully help us understand how these bones are going to fit nicely in with the humerus. The proximal end of the ulna sort of looks like a claw, or a hook, if you will. The upper portion of that hook, the larger of the processes, is referred to as the olecranon process. And the olecranon process will be on the posterior side of the body when in the anatomical position. The olecranon process makes up the majority of what's known as the trochlear notch. This here is the trochlear notch, and the other portion of the trochlear notch is made up by what's referred to as the coronoid process. So the coronoid process can be found here, and the olecranon process can be found up here, and together these make the trochlear notch. This is just another picture to show you the olecranon process, the coronoid process, and the trochlear notch. Now, one nice way to remember how the ulna is named is the ulna has a U on it. And so this is one easy way to remember which bone is the ulna. Now, the next thing that I want you to understand about the proximal end of the ulna is that the olecranon process and the coronoid process will sit in their respective fossa that can be found on the humerus. So as a little review, the humerus's distal end has an olecranon fossa and a coronoid fossa. The olecranon fossa is on the posterior side, and the coronoid fossa is found on the anterior side. So when these two bones are nicely articulating, the trochlea sits within this trochlear notch, hence where this gets its name. And the olecranon process will sit nicely in the olecranon fossa, and when we fully flex the arm, the coronoid process will sit nicely in the coronoid fossa. The one other major structure found on the radius that we need to be aware of is the radial tuberosity. A tuberosity is just a large rounded projection that sticks out from a bone. This is going to serve as an attachment point for muscle tendons and ligaments. This slide just gives you another view of the radius. The radius can specifically be identified because it has this nice lip at the end. Now, if we look at this picture, this is showing us the radius, and this is showing us the ulna. We can see the large olecranon process, the smaller coronoid process, and the trochlear notch that's formed between the two. But the radius can also be found here, and that's what we really want to focus upon. I've already explained that the ulna has a nice U on it, and that's what's going to help you distinguish the ulna from other bones. But the radius has a little trick as well. In fact, from this view, the radius looks like a perfect circle. And I know my lines are not perfect, but they should do well enough. And so as we can see at the proximal end of the radius, there's this perfect circle. One little way to remember what bone this is that every circle must have a radius. So hopefully those little tricks for the ulna and the radius are beneficial to you. And so that will take us into the hand. We're almost done with the arm. The hand can be split up into several different groups. We have carpals, metacarpals, and phalanges. The carpal bones can be found in our wrist. The metacarpals are found in our hands, and the phalanges are making up our fingers. Specifically, there are 8 carpal bones, but I am only going to make you learn 3 of these. And the 3 that I want you to understand are the trapezium, the scaphoid, and the lunate. The trapezium bone is specifically the bone that articulates with the thumb, so we can see that one here. One way that we can remember this is the trapezium is going to be connected to the thumb. Just below this and articulating to the distal end of the radius is the scaphoid bone. Now I'm going to go here and show you that the scaphoid bone is roughly shaped like an S. So another easy way to remember the scaphoid. That's going to articulate here with the distal end of the radius. And here at the distal end of the ulna, we have the lunate bone. And so you can see the first 4 letters of the bone lunate would actually be rearranged to spell ulna. And that's how you know that this bone is found articulating with the ulna on the medial side. Now that leaves us with the metacarpals and the phalanges. There are 5 metacarpals that can be found in the hand, and there are 14 phalanges that can be found in the fingers, making up each finger. Now we name each of the metacarpals based on which digit they correspond to. So this bone specifically is found in the thumb, and this metacarpal is going to give rise to the bones in the pinky. So each of these bones are named in a naming system. We would call this bone metacarpal 1, metacarpal 2, metacarpal 3, metacarpal 4, and metacarpal 5. They don't have unique anatomical names like the rest of our bones. We use a numbering system to name each of these. Now when we get to the phalanges, you'll see that there are several bones that can be found in each of the fingers. The index, middle, ring, and pinky fingers will all have 3 phalanges, and the thumb will only have 2 phalanges. Based on their position, we give each of these phalanges a name. This here is the proximal phalange of the first metacarpal. This is the proximal phalange of the second metacarpal, the proximal phalange of the third metacarpal, the proximal phalange of the fourth metacarpal, and lastly, the proximal phalange of the fifth metacarpal. Now, since the thumb only has 2 phalanges, this is going to be referred to as the distal phalange of metacarpal 1. This is the distal phalange of metacarpal 2, the distal phalange of metacarpal 3, the distal phalange of metacarpal 4, and the distal phalange of metacarpal 5. Now, that leaves these 4 bones that can be found here in the middle between the distal and the proximal phalanges. Again, the thumb's not going to have one of these bones. The thumb only has the proximal and the distal phalange. But each of the other digits are going to have this middle phalange, and that's exactly what we call it. The middle phalange of metacarpal 2, the middle phalange of metacarpal 3, the middle phalange of metacarpal 4, and the middle phalange of metacarpal 5. So as we move more distally, we have the lunate, the scaphoid, and the trapezium, followed by metacarpal 1, metacarpal 2, metacarpal 3, metacarpal 4, and metacarpal 5. Each of these digits are going to have a proximal, middle, and a distal phalange, with the exception of the thumb that will only have a proximal phalange and a distal phalange. Now this naming system will be used for both of the hands, and it will also in fact be used for both of the feet as well. So when we get to the feet, I will show you that we use the exact same naming system. There's just one major difference. Just keep in mind that in the anatomical position, the thumbs are positioned more laterally and the pinkies are positioned more medially, and that's why the ulna is on the pinky side and the radius is on the thumb side. Now, as we've just reached the phalanges, that completes all of the bones that can be found in the arm. The next major component of the appendicular skeleton is referred to as the pelvic girdle. Now, the pelvic girdle is made up of these 2 coxal bones. There's one on either side. So again, only 2 bones make up the pelvic girdle. Here in the center, we can see the sacrum. Remember, this is still part of the axial skeleton. So each of the coxal bones are made up of 3 separate bones, namely the ilium, the ischium, and the pubis. And on the next slide, I will depict each of these bones in different colors. But I first want us to understand some anatomical landmarks that can be found specifically on the pelvic girdle. So the first structure that I want to mention is the sacroiliac joint. Now, as many other things in anatomy and physiology, even though this is a big word, it's a big name, it really appropriately describes the structure that we're referring to. This is the joint between the sacrum and the ilium. In fact, this upper portion of the coxal bone is the ilium bone, so that's why we call it the sacroiliac joint. we will come to find out that this portion of the coxal bones is referred to as the pubic. And so as these two pubic bones come together, we form what's known as the pubic symphysis. A symphysis is a joint that is fused with fibrocartilage, and that's exactly what we see here, a tiny disc of fibrocartilage. Another structure localized to the ilium is the iliac crest. And a crest is a narrow ridge that can be found on a bone. Again, serves as a surface area for muscle and ligament attachment. So the iliac crest can be found here on the edge of the ilium. Now, one of the more major structures that we see here on the coxal bones is the acetabulum. The acetabulum is a socket, or a very, very large facet, that will allow for the head of the femur bone to come in and articulate. The femur, again, is the bone that stretches from the hips all the way down to the knees. So the acetabulum is the major place on the coxal bones where we're going to have articulation with the bones that give rise to the legs. We will find this much larger hole at the inferior sides of each of the coxal bones. This is what's referred to as the obturator foramen. We have an obturator nerve that will actually pass through this hole. And lastly, one more structure that's going to be relating to the pubic region is the pubic arch. The pubic arch specifically refers to this line that I have just drawn in. The pubic arch refers to the angle of these two bones coming together. And we can actually use the pubic arch in determining whether a pelvis belongs to a male or a female. And I will show you how this is done towards the end of this presentation. Now this slide will really show you the different parts of the coxal bones. We have an ilium, an ischium, and a pubis. The ilium is this upper portion, often referred to as the wing of the coxal bone. And again, when I go back to this slide, you'll see that this portion is really referring to the ilium. Now, down here towards where the buttocks can be found is the ischium. The ischium is also going to play a major role in making up part of the obturator foramen, and you'll also see that all three of these bones play a role in making up part of the acetabulum. The last of these three bones that make up the coxal bone is the pubis, and these two bones will come together to form what's known as the pubic symphysis and also give rise to the pubic arch. One other structure that we have here on the ischium is the ischial tuberosity. This again is a large projection, a rounded prominence that's found off of the ischium, and that's why we name it the ischial tuberosity. Now towards the posterior side of the coxal bones, we'll find the greater sciatic notch and the lesser sciatic notch. And I'm sure you can assume why these are called the greater and the lesser notches. This one is clearly bigger than this one. This posterior part here, found behind the coxal bones, can often be referred to as the sciatic region, and we will have a large sciatic nerve that courses back here. Now both of these notches, the greater sciatic notch and the lesser sciatic notch, are separated by the ischial spine, which can be found here. So you can see some of these structures, like the greater sciatic notch, is made up as part of the ilium and the ischium. Some of these structures, such as the acetabulum, is made up of the pubis, the ilium, and the ischium. And the obturator foramen is made up of the ischium as well as the pubis. Now, as we continue to work our way more distally down the leg, we have the patella. The patella is often referred to as the kneecap, and all you really need to know about the patella is that the posterior side has a large flat facet on it. It's going to articulate with the femur, and it's also the largest sesamoid bone found in the body. Sesamoid bones are wrapped up in tendons, and this is one bone that is wrapped up in what's referred to as the patellar tendon. So you can see that found right here on the patellar region, which is where the patellar region got its name. Now on this slide you can see that we're going to include the femur. The femur stretches from the hip all the way down to the knee. And just as with the humerus, we have a medial epicondyle and we have a lateral epicondyle. The medial epicondyle, once again, will be a little bit more pronounced than the lateral epicondyle. Both of these are raised areas next to condyles. Now the femur will also specifically have what's known as the medial condyle and the lateral condyle. You'll see both of these found on either side. This here is the medial condyle, and this is the lateral condyle. Now we can use the same trick with the head of the femur to help us understand how the femur articulates with the coxal bone. The femur specifically is going to sit in the acetabulum of the coxal bone, and the head of the femur is what sits in there. This here is a ball and socket joint. You can see the head is nicely positioned to sit within a very spherical-like facet. So here, once again, we are looking at a right femur. Now let's take a second to look down here at the distal end at the lateral and the medial condyles. Remember that condyles are projections for joint formation. So these are directly going to articulate with the bone found in the lower leg known as the tibia. This is the bone that can be felt on the shin. So we have epicondyles on either side, which will allow for muscle and ligament attachment. And we'll have these different medial and lateral condyles on each of our femur bones that will allow for joint formation. Now, again, as previously discussed, we have the head of the femur, and the femur specifically is also going to have a very narrow neck as well. This gives rise to the head. My little saying for the femur is that every head must have a neck. Now, we'll also find the gluteal tuberosity and the intercondylar fossa that's found on the posterior side of the femur as well. The gluteal tuberosity is found right in the gluteal region, towards the back of the proximal side of the femur. This little projection out here, again, is a tuberosity, which fits into our group as a projection for muscle and ligament attachment. And as the name would suggest, the intercondylar fossa is the fossa or the notch that can be found between the two condyles. So once again, another structure that we really don't want to overthink. Condyles are projections for joint formation, so we'll see these nice flat condyles here at the distal end of the femur that will aid in the articulation with the tibia. And the epicondyles are raised areas just above the condyles. Those are serving as muscle and ligament attachment positions. So we'll see those found just above the condyles, and right in between we have our intercondylar notch. We will have the ACL and the PCL that can be found in here. Now the femur is the only bone in the body that contains what's known as a trochanter. The femur has two trochanters, a greater trochanter and a lesser trochanter. The greater trochanter is slightly larger than that of the lesser trochanter. The greater trochanter can be seen from the superior aspect of the femur, and the lesser trochanter is more so located on the posterior side. However, the trochanter is large enough that you can actually see this from the anterior side of the bone as well. One way to tell the difference between a right and a left femur is the back side of the femur tends to be a little bit more rough looking, and it has this line down it called the linea aspera. The anterior side of the femur is much more smooth, and it's slightly bowed out towards the sides. So you can see the head of the femur must be pointing medially so that it will sit nicely within the acetabulum. This picture just shows you a left femur as we've gone over a right femur so far. So again, I'm going to want you to understand how to distinguish a right femur from a left femur, a right humerus from a left humerus. We have to be able to side each of these bones. So along with the femur and the humerus, we'll also need to be able to side the scapula as well. Now moving below the femur and below the patella, we have the tibia and the fibula. The little trick to remember which of these is the tibia and the fibula, of course the tibia is bigger, but the tibia is also shaped like a T. So hopefully you won't forget which one the tibia is. The fibula can be found much more laterally, and it's a lot more slim than the tibia is. Now the tibia and the fibula are not as involved as the rest of the bones. Here on the tibia we'll find the medial condyle and the lateral condyle. And you can probably deduce that the medial condyle of the femur is going to be sitting right up here. So this is the medial condyle of the tibia, and this here is the lateral condyle of the tibia. Now nicely named right here at the anterior aspect of the tibia is the tibial tuberosity. And this is a structure that you can feel on yourself as well. Aside from these last two structures here at the bottom of the page, the only other thing that you'll need to know at the proximal end of the tibia and the fibula is the head of the fibula is going to articulate on the lateral side of our tibia. The fibula is always lateral, the tibia are always medial. And you can actually touch the tibia when you are feeling the inner side of your shin. Now here at the distal end, we have a medial malleolus and a lateral malleolus. Both of these together form this little notch that will nicely sit on the most superior tarsal bone. The medial malleolus can be found on the tibia, and the lateral malleolus can be found as part of the fibula. This would make a lot of sense because the tibia, being more medially found, is going to contain the medial malleolus, and the fibula, which is more laterally found, will contain the lateral malleolus. And this picture just shows you a right and a left tibia and fibula as they articulate. So to really hit home the point, the fibulas are always found on the lateral sides. Now, as we finish up the appendicular skeleton, you will see that the foot has a very similar structure as the hand. The foot, instead of having carpals, is going to have tarsals, and there will only be 7 of these. And here we'll have metatarsals and phalanges. So instead of the carpals and the metacarpals, we have tarsals and metatarsals. Here we will still have phalanges. But again, based on the way we name phalanges, these are now phalanges of the metatarsals. Now you'll only need to know 2 tarsal bones, namely the calcaneus and the talus. The talus is the bone that is most superior of all of the other tarsals. The talus is what will sit in the notch that's formed by the medial and lateral malleoli. And again, those were found on the tibia and the fibula. The calcaneus is the largest of the tarsal bones, and it can be found making up the heel. And this is where we get the term the calcaneal region from, is from the name of this bone, the calcaneus. Now, in terms of naming the metatarsals and the phalanges of the feet, we use the exact same naming system as we did in the hand. You can see that the largest of the metatarsals will get the term metatarsal 1. So this is here, metatarsal 1, this is metatarsal 2, metatarsal 3, metatarsal 4, and metatarsal 5. We have the same system here as we had in the hand, where the largest of the metacarpals was found in the thumb, and we called that metacarpal 1, and we worked our way over to the smallest of the metacarpals, which was metacarpal 5, giving rise to the pinky. Here we have the largest metatarsal, giving rise to the great toe, and all the way down moves its way to the metatarsal 5, where we'll have the little toe. Now, in terms of the phalange arrangement, it is just the exact same as in the hands. We have 2 phalanges on the great toe, and the rest of the toe digits are going to have 3 different phalanges: a proximal, a middle, and a distal phalange. So here at the great toe, we'll just have a proximal and a distal, and for the other 4, we'll have a proximal phalange, a middle phalange, and a distal phalange. There was one minor difference that I mentioned between the arrangement of the hand and the foot, and that is that the hand's first metacarpal is found more laterally, while the foot's first metatarsal is found more medially. The dorsal side of the foot can be found on the superior aspect of the foot, and the sole of the foot is what's referred to as the plantar region. The sole of the foot is synonymous with the palms of the hand, and the back of the hands are synonymous with the back side or the dorsal side of the feet. So just something to keep in mind with this naming system, you want to stick with the largest of the metabones first. Now, the last concept that we're going to cover here for the appendicular skeleton are differences between male skeletons and female skeletons. As I explained with a few of the bone markings in the axial skeleton, bone markings in males tend to be more pronounced. The glabella of the frontal bone is one example that's going to be much more pronounced in males in general. Now, bone also tends to be much denser and heavier in the male as well, so the male skeleton will weigh a little bit more than the female skeleton. Now, we can actually make the determination from some of these structures whether or not a pelvis belongs to a male or a female. And that is done with a few different characteristics of the pelvis itself. The first of which I'm going to mention is the pubic arch. The pubic arch in males makes an acute angle. It's going to be less than 90 degrees. And in females, it's going to be bigger than 90 degrees. So we would have an obtuse angle indicating that we're looking at a female pelvis. The sciatic notch size is also something that you can use to determine the gender of a pelvis. Here is the pubic arch, which you can see here, and here is the sciatic notch. Now, I'm really going to use the pubic arch because this is a much easier indicator to use. The pubic arch in males is going to be less than 90 degrees. It's going to make an acute angle, and in females, it's going to make an obtuse angle. So you can see that nicely shown on this slide, right here in the center. This is showing us a male pelvis down this column, and this is showing us a female pelvis down this column. You can see in the male pelvis, we'll have an acute angle here at the pubic arch, and with a female pelvis, we'll find an obtuse angle that's greater than 90 degrees. These differences arise from the necessity of the female pelvis to meet the requirements of childbirth. We have to keep in mind that the female has to pass a baby through the pelvic girdle. The male doesn't have to do this, so it doesn't need to be adapted for squeezing a person out of this pelvic inlet. And the pelvic inlet is another thing that we can see that's different in males and females. Naturally, in the female, the pelvic inlet's going to be larger because it needs to accommodate the size of a baby passing through it. Here, with the male pelvis, the pelvic inlet tends to be more heart-shaped, while the female pelvis tends to be more oval-shaped. The last major difference that I want to mention is the concavity of the sacrum. You can see that the male sacrum sits right in front of the pelvic inlet, and that doesn't facilitate passage through this pelvic inlet. The sacrum would be in the way if we needed to pass something through here. But we'll see here with the female pelvis that the sacrum is actually angled backwards, and that allows for more room to squeeze a baby out of this pelvic inlet. Now, some of the other gross differences between male and female pelvises are strictly the size and shape of each of these pelvises. The female pelvis tends to be much wider, and the male pelvis tends to be much taller. And hopefully, as I've pointed that out, you can see that this one is a lot more wide than this one. As a result of this, the female pelvis tends to be much shorter, and the male pelvis is going to be much taller and much thicker. We see that the female pelvis is much more wide, and the male pelvis is much more narrow. So there's lots of ways that we can tell the difference between the male and the female pelvis. So that will conclude the PowerPoint slides pertaining to the appendicular skeleton. Please make sure that you review these and reach out if you have any questions at all. Always remember, I'm here to help, and I will see you for our next presentation.